I appreciate being able to be here today. As Susan said, my name is Kristine Pendy, and I am the Chief Clinical Officer at Bergen-Newbridge Medical Center. For those of you who just need a quick update on the hospital, we do have 323 inpatient behavioral health beds. We provide our services and care to children, adults, and our seniors. We have very comprehensive addiction service line, as well as behavioral health, which includes dually diagnosed and co-occurring patients who need our care. And we have a very comprehensive outpatient services, both currently operating in person, as well as based on our patient request, we provide virtual care as well. So I'm very grateful to be here today to speak on grief. I actually added loss to my title of today's presentation so that I could incorporate it into our thought process, because as we look at grief, we're also looking at loss. And during COVID-19, it's very important to expand our understanding of what grief is. So I want to start by giving us an idea of where we are at in our nation in regards to COVID-19. So in the United States at this time, and I pulled these statistics from yesterday, there are 2.8 million diagnosed cases of COVID-19 and 583,000 deaths. These are extremely large numbers and numbers that we see on the news, but in the context of this discussion, it's important to put that into context, both for the state of New Jersey and for us here in Bergen County. In New Jersey, we've had 1.1 million cases for our state and 25,753 COVID-19 related deaths. For Bergen County, which many of us know was the initial epicenter of the epidemic here, we have 103,000 cases and 2,849 deaths just in our area here alone. So when we talk about experiencing grief during the COVID-19 pandemic, we need to put again into context that grief is a very normal response to loss. It occurs during deaths, but it also occurs during a disaster or traumatic events. Grief can happen for a variety of different reasons. It's most easily associated to the loss of life. And based off of the statistics that I provided, you can see that there's probably not going to be anyone listening to this who hasn't had a loved one pass from the COVID-19 virus, know someone who passed because they could or couldn't get to care, they waited too long to get to care out of fear. Somehow each one of us have been touched by some level of loss. But it also, when we look at grief, it also is about the changes in our life, a drastic change to our routine, the way that we are comfortable and accustomed to living our lives, and that feeling of stability that comes from that level of routine. 18 months ago now, before the stay-at-home orders all went into effect, and before this was what we all know, had to learn, had to live with, we got in our car in the morning, we did our daily routine before we did that, and we went to our employment, whatever that may be. And for those of us, and thank you all for what you have done through this pandemic and continue to do in healthcare, because we went to work in many ways, no matter what, and put ourselves in that front line of this pandemic to battle what we were seeing in front of us and provide that quality health care. But for so many people, when they used to get up in the morning and get in their car and drive to work and see their colleagues and do that job that they loved, and then come home and go to the grocery store and maybe take their family out to dinner, maybe go to a movie, all of those things, when the stay-at-home order went into effect, went by the wayside. And we have to acknowledge that in a traumatic experience, an event like this, that this grief and loss that people are experiencing is beyond that of the loss of life. It really is about the loss of that structure and that routine that we're accustomed to. And there is a reaction, obviously, to grief. And it's important for us, certainly as healthcare providers, to recognize what that looks like so that we can be in tune with what the person who's presenting to us for care is in need of. So some of the common grief reactions are shock, disbelief, denial. You can see a large, and we, in behavioral health, we saw a very large increase in anxiety, in depression, and in substance use, because of experiences of distress. Folks had experiences of anger, even periods of sadness, loss of sleep and loss of appetite related to some of the concerns and some of the fears that were opening up. Who would have ever thought in our lifetime that we would go to the grocery store and hunt for, we all joke about the hunt for toilet paper and the hunt for cleaning supplies. But who would have ever thought that we would have found ourselves with empty idle aisles trying to figure out what we would do? And for folks that are going through some experiences around this, to add that to their daily experience, really that's where you see that increase in anxiety and depression. In June, the Mental Health Association of America posted some statistics that really reflected that the increase in traumatic responses by 40 to 50%, in anxiety and in depression by 40 again to 50, to some in 60%. The stay-at-home orders really triggered some of these experiences. So I think it's important to speak about grief as just as a concept, as a context. It's a very strong and can be very overwhelming at times emotion for people. Regardless of whether it comes from sadness or from loss of a loved one or from a terminal diagnosis, it is a very powerful experience that's very individualized for each person. There's not a cookie cutter response to I am feeling grief, and these are the ways that I feel it for us to look out for. So those experiencing grief, they find themselves numb at times because they're removed from that daily life. They're unable to carry on with those regular duties, that they are saddled with this tremendous sense of loss. It's a very natural reaction to experience grief during loss. It's very universal, but it is for sure very personalized. Individual experience of grief, they can vary. They can vary and be influenced by what is lost. The loss of a family member, a close family member, a parent, a child, can sometimes be quite insurmountable, and as we all imagine, very understandable. But if you apply that to the loss of a job, the loss of family, friends, the loss to your daily routine, the loss of going to school for our children, this has become that of a grieving experience. And now, as we're seeing the stay-at-home orders lifting and seeing more comfort for all of us to entertain those activities again, whilst you see that lessening of that grief experience, you will see the increase in some folks who are much more anxious, are much more fearful, that feel that there is something wrong with them because they are not embracing the comfort level of going out to their favorite restaurant and seeing people that they were connected to again. And you would think that we would all run to it, but there are very many folks who are really still struggling with their comfort level around the COVID-19 pandemic and their ability to just regain. Somebody's going to run through the door and be excited, and someone else is going to struggle. When we think about losing a loved one, we can see that in how folks mourn the lossing of their mother or the loss of mourning their father. It's not, set for every person. And so the type of relationship, the way that they acknowledge that relationship and what it mattered to them, again, very individualized, can show you the trajectory of how that personal experience can impact on that loss. So, experts will tell us that grieving is, can't be controlled. And it can come through in varying stages, but we really have to understand why people are suffering so that we can provide them that guidance and that assistance, talking to others and talking about what their issues and feelings are, and understanding the significance of their emotional pain and what they're feeling about the loss, whether it be a loved one with the type of loss, and their relationship with the person that they've lost, or with the loss of a job or the loss of finance. When you think about their connection to their job, that it was their perhaps their fiber of who they were, and without it they feel a loss of identity, or the financial implications of losing a job and what that maybe means to who they care for in their lives, whether it's their immediate family, if they're have children, or if they're supporting folks in their family who they now feel a sense of guilt over the death of someone and their relationship, or a sense of guilt over their ability to continue to care for people, and that in some ways that they have let them down. You can certainly see how these impacts will increase folks' anxiety and potentially allow for an experience of depression to create itself and to become all-consuming if there's not an end at the end of the tunnel, shall we say. So mourning in itself can last for several months, and for many for years. When we pull on our own personal experience, we can see from those around us. I have friends, colleagues, loved ones in my lives who have lost their, mother. And for one, it was, my mother is in a better place and has moved on. And I'm happy for that, and I can put it in perspective. And while I miss her, I am able to move on and celebrate her life and reflect on the pearls of wisdom that were passed to me and impart those to those I interact with. But for others who have lost their loved ones, there are tremendous issues around the relationship and how the person passed. And it has taken, that particular person years to come to terms with the feelings of guilt, the anger and anguish within the family dynamic. And while each year it changes and becomes something different, that bereavement, that pain that is associated to it, is one that is changing over time, but is ever present. And it's a realization that, we've lost, or in some instances, when someone receives a terminal diagnosis, we have that opportunity to mourn first. But that really presents, I'm mourning you before you have left us. And again, that guilty feeling that can come, that we have to then be able to deal with for the rest of our lives in many ways. We all hope that this happens in a healthy way, and that we can, talk with those around us that we love and that knew the loved one, just like we would talk with them about losses of jobs and finance, and be able to put it in a healthy perspective. Unfortunately, it is not the case for everyone. And that's why we're having this conversation, because the amount of loss, the amount of trauma, and the amount of death that we have seen as a world, as a nation, as a country, as a state, and here in Bergen County is, again, significant. Again, no one not touched by this loss. So managing grief in a healthy way is extremely important. The pain and grief can feel like an ever-present weight, right? That is with us in all moments of time. And learning to manage the grief in a healthy way, it can be a struggle. It can be stigmatizing for some to think, I'm supposed to get past this. I'm supposed to be okay with this. But everyone's process of loss and grief, as I said, is individualized and is different. And healing occurs for all of us and those that we treat in very, very different ways and at very, very different rates. So some people feel that certain forms of grieving, they can be very disrespectful. We need to remember that there are a lot of cultural aspects to each of us, and traditions and expectations in our own families of ways of being done. So what is okay for one person in a particular culture to, I happen to be of a very Irish descent, to have a party and to celebrate with a shot of alcohol, to celebrate the life, to someone else seems very disrespectful to celebrate the loss, and really not mourn and have that set grieving period where the expectations are very different. So it's important for us, particularly as healthcare providers, to be able to be in tune with the person in front of us, what their experience is, what their culture is, and what their expectations for themselves are around those types of losses, so that as we are looking at helping, we're in tune with what it means to them. We need to put our judgments away to some extent and be accessible to what is happening for that person, again acknowledging it's different for everyone, so that we can get them to the right place. It's important for all of us to note that there's no correct way. There is no book, there is no cookie cutter approach that you grieve in a particular way when you have a substantial loss. What does grief bring to the person who is experiencing it? It's a tremendous, raw, heavy, intense emotional experience that at times, as I said, can seem quite impossible to handle. Others may not even realize to the extent that someone is grieving because they've tucked it away. And this intense, raw emotion can bubble to the surface at a moment that's unexpected. Loneliness can be very common when one is grieving. And you can withdraw from social situations and from other people because you don't want them to ask, how are you? One of the questions many people who are grieving, it's natural for all of us when someone returns from a leave associated to a loss, to say, how are you? I'm so sorry for the loss. I counseled, so many of my staff, so many of my family members, so many of my colleagues, that it's okay to say, I'm not ready to talk about that, or thank you, but I've asked people to let me know how they would like to be greeted and returned, and have let folks know that this person would prefer that you don't speak to them about it in the moment. These are all ways that folks can come back into their life and deal with that guilt and take those steps to move through. But some folks will withdraw because they're not ready to deal with the question. They're not able to have that social interaction and be able to answer the question. And partially because they're so concerned about what the assessment will be, the experience of them will be if they just fall apart, because the emotion is still so intense and so raw. Some people feel a large amount of anger towards, when there's a traumatic event, something that has happened to those in their family members. And we have to be sensitive when people lose people tragically in drunk driving accidents or at the hands of a violent event, that in addition to that experience of loss, they are also angry at the system or the legal system or the person or varieties of things, and that couples with that raw emotion of grief and loss, and it really catapults that experience to another place. You can often find people during these times may, experience a loss of appetite and withdraw on their feelings and become rather apathetic, and that sadness becomes so significant. So some of the first steps to being able to move forward is to recognize when one is feeling those experiences of grief, and recognizing that it's normal because there's no set response. And helping folks to understand that they don't have to grieve and have a very set experience can allow them the freedom to experience that grief in their own way. Again, this is acknowledging that different cultures and societies grieve differently, and that really we have to help people understand that no one should ever feel pressured to grieve in a particular manner that's not comfortable to them. And that, if a person needs to grieve loudly and openly, that's perfectly normal. It's also important to help them understand that everybody's reaction to someone's grief is equally not cookie cutter and specific, and that some folks might not know how to deal with an open, loudly grieving experience, and they might not know how to help. I know for so many, I don't know what the right thing is to say. And it isn't a matter of learning, which emotion you can express and which emotion you have to put away and you have to subdue, but rather just allow that grief to come and go naturally and acknowledge it. So that people can feel comfortable and they can learn how to deal with their grief and get through to the next step. Expressing grief and mourning, they're unavoidable. Again, we can't repress it. We can't ignore it, because that will lead to additional and other feelings that will become complex to manage. There's a lot of outside influences that affect the way we should grieve. We all try to speak to individuality and to being our own person and not to worry about what others think. But we all know on a day-to-day basis that we are being looked at for how we act and how we dress and how we handle certain situations, including grief. So it's not something that we can say it doesn't matter what anybody thinks, but we have to be okay with allowing ourselves to mourn openly and outwardly, not feel that restraint and restriction and bottle it up, but understand that everybody else might not be comfortable with it and that we need to manage those experiences as well. You'll see folks that will cry, some folks who will yell, some folks who will laugh. I can say that I lost a dear friend in very early on in college, in another country, in a tragic event. He actually wound up saving somebody. He was struck by an epileptic driver in London, backpacking through Europe and staying in a youth hostel, and a very young gentleman. And I can remember being at his service and being with high school and fellow college friends and talking about his life. And one of our friends was mourning, in a very different way. And we were talking about such cherished moments with him. And one of our friends laughed, and it presented in a way that was quite challenging to this other friend. She took quite great offense. And it really it created a bit of a rift between friends that has since been remediated. But it's important to know that celebrating the life is okay, as much as crying and yelling to get the anger out or to get the feelings of grief out and depression out. It's also okay to celebrate, whatever that form of mourning is for you and for those that you're working with. It's integral that, part of reducing the intensity of the grief is that expression, is that allowing us to get that out and supporting it. It's very important during these times to find support. After a loss, many people can begin to withdraw from others, especially individuals that they may associate with that grief. And, it's important to note that this applies not only to the loss of life, but it also, again, applies to loss in other places and grief about other things. For example, a divorce. It is not uncommon for friends that are married or the person who is becoming divorced to find find themselves in a situation where they are separating and not as connected as they were. And that's for a variety of reasons. Again, not knowing the right thing to say, not wanting to add discomfort to someone by asking the wrong thing, being friends with both parties and things along those lines. You know, when we think about what is the right thing to say at the loss of a child, what is the right thing to say at the loss of a spouse, especially if someone is young? You know, a tragic accident that takes the life of two family members at once, which I've recently encountered. You know, what is the right thing to say to somebody? You know, the standard is for many of us who don't know what to say is to say, I'm so sorry for your loss. But what does that really mean? So you can find folks that will separate from each other, either because of the person who's had the loss or the person themselves who's had the loss. You know, we've seen so many of our colleagues, so many of our friends or family who have lost their employment, lost their jobs during the COVID-19 pandemic, much not to their fault, but a reality of, you know, not having businesses open or businesses closing, reducing our workforces, going to virtual, not needing office staff, and all, you know, all of these different scenarios. And, you know, what do you say to that person? I'm so sorry you lost your job. How are you managing to pay your bills? You know, all of this discomfort can force us into a separation from each other. So being supportive, you know, helping that person and ourselves to move forward, and you know, finding a support, whatever that may be, is important to help each of us and that person to get through the process. Even people who have never experienced a loss, you know, we don't have to experience a loss to be able to anchor someone who's experiencing grief. We don't have to know exactly what the experience is to say, I'm here for you and I support you and I can listen. I think probably the most important conversations that I've had in my career, and certainly through this COVID-19 pandemic, has just been simply the ability to listen and hear someone who is struggling and let them know that you might not know all the right answers. We don't always have to have the answers, but that I can listen and be here for you. I can be a sounding board. I can listen to what your thoughts are and let you bounce things off of me as you make your decisions about what is next. You know, friends can be of great support, family, but sometimes that's not where folks want to go. They want something neutral. So seeking out support groups or our communities are also tremendous opportunities for us. You know, it's important for us, and so important right now for us to live normally. We need to get back to normal, something we're all trying to do now. I know I have a almost 17-year-old who has been half virtual and half in person for quite some time. She was somebody who was not ready to go all virtual and stay home, which was what was important for her, and I supported. And, you know, her school is going back on May 17th to full day activity. And as I read, you know, in my town in Bergen County, you know, the mom page, there is such a wide and vast variety of that live normal. You know, how can they be doing this the last few weeks of school? Why would they put the kids at risk at this point? My child can't go back. My child will be left out or left behind because they're not going back. There's such a sense of pressure, and it's important for all of us to decide the right thing to do and not to judge. I've seen some, you know, social media is a challenging entity, and the more virtual we have become and the more virtual we stay, we're going to need to be cognizant of our judgment and our opinions as we look to help people in those forums. But I have seen some exceptionally harsh responses that are not very individualized, that really hurt and stick with people and add to the experience of stigma, and I'm not doing something the correct way. So, you know, living normally, you know, it's not a sign that we have forgot about what has happened. When we look at the numbers at the beginning that I presented, you know, we have not forgot those that we have lost. in Bergen County or that we have lost in our state and our country, but getting to the point where we can move forward is important. There will always be a part of our lives that will be part of this experience, and that person that we have lost or that experience that we will have will guide us into who we are in the future, and guide those that we are working with. You know, no one should force themselves to do anything that they're not comfortable in doing. We need to make those experiences, those decisions individually, so that we can move forward and not create, again, going back to those raw emotional feelings that if we don't address them and if we're not in touch with them, can create other issues. It's fine to start small. It is fine to go slowly and work back up to a normal level. We don't have to be out of the gate the second that it opens and running to be able to do things that are normal, as we like to say now, but we can take them in small steps and reacclimate ourselves. And we need to remember that there's no right way to do that. You know, we want to live healthy. Disruptive sleep, loss of appetite, a general loss of interest that accompanies grief. These can have a dramatic effect on our health, and ultimately they can prevent us from healing. Living a healthy life may seem, you know, kind of irrelevant to some or useless after a loss, but it does help many people get back onto track. Being able to exercise, go out and walk during a time that maybe we would reference as disoriented. We're trying to get back to normal. We're trying to do things that are different. Eating healthier, addressing some weight issues, weight loss. You know, a lot of people will emotionally eat through a traumatic event, a loss. And they will then have the added complication of having health issues and having weight that they don't want, which now brings appearance issues. Those are all real. And so when we get to the heart of that emotional experience, we can then start to tackle some healthy living experiences. How many of us have talked about, you know, the weight that we unfortunately put on perhaps during, you know, the pandemic and being at home. And for one person, maybe they didn't eat out as much and they cooked healthy, and so they didn't have that experience. And for others who maybe didn't know how to cook as well, or didn't know what to cook, or didn't have access to certain things, they really put on a good deal of weight. So now they're dealing with that need to lose, and that what that people may sense about them as they return back to normal, they return back to school, they return back to work. You know, involving friends and family members with meals or exercise can, you know, really provide additional motivation and kind of, you know, alleviate some of those feelings that I spoke to earlier about, you know, separating and social isolation and loneliness. So it's really important through a grieving period that we find a balance. Grief and its accompanying emotions have a way of spreading through every moment in our lives. We've talked about weight loss and weight gain and emotional eating and potential health issues associated with intense grief and not taking care of ourselves. You know, it's a very active process to be going through and trying to be healthy in your grief. So finding that balance between grieving and what that means and not grieving can be the difference between healing and letting grief swallow us whole. Being very in touch with our experiences and what it relates to and how we are coping can help us understand that the grief is becoming insurmountable and we need to make a change. And that's where we reach out to those friends and family members to gain help. You know, gently finding moments and pockets where we don't actively grieve can also help us move forward. And then, of course, we always want to recommend to folks that there is nothing wrong with seeking out support and counseling to be able to get to a trained professional when perhaps it has become more insurmountable to you as a person or those that are around you, and having that neutral person with that training and professional skill to help you be able to address those issues that maybe you can't address on your own, identifying those places where you're being swallowed, and start to help you little by little to identify how you can move forward with dealing with that sense of loss. Always keep in mind that grief can be, very unpredictable. It's completely an unpredictable force. No matter how much time passes since grief, it can come out of nowhere like a tidal wave. All it takes sometimes for some folks is simply a memory to return the pain, and then you're back in that place again. So remember that just because you have moved past the grieving experience in a particular moment, you can then return to it, and it can take you off balance. It can surprise you when you think that you have kind of made it part of your life and moved on. So it's important to treat these moments as signs that the loss has become part of you, and that your loved one is always with you, but that you want to be mindful that that can occur. Now, some people may experience multiple losses during a disaster or a large-scale emergency event, obviously, very obvious with COVID-19 pandemic. You might be, your losses are more significant because we're not just talking about the loss of life with this particular pandemic, as I said earlier. You might be unable to be with loved ones when they have passed, not able to hold their hands. I can tell you that we did this, and I know that you folks at Valley did this as well, as in our healthcare profession, many did, to be the person holding the hand, to hold the iPad for family members who couldn't come into our medical centers, to be there with them, to say goodbye over a virtual platform, to have a funeral over a virtual platform, as a healthcare provider, to not be welcomed or to feel that you were not welcomed because you work in a medical facility and COVID-19 was still real at many points in our experiences. And we felt that maybe we weren't welcome. I ran the hotline here for our staff at Bergen Newbridge Medical Center, and we dealt with so many of these experiences. One of my colleagues who is in the ED, who worked on the front line of all of this and did all of the things that we did to help people get through, experienced her own family member passing of COVID-19 at a distance and needed to say goodbye on that iPad and deal with that grief, that funeral streaming. And when she and I talked about it at great length, it was very important for her to say to me, I didn't realize what it was like until I experienced it myself. While she was doing it, she felt that she was there for people and that connection. But when it was her own experience, she realized how it wasn't enough and that it didn't replace. And she had to come to terms with those two experiences. Other types of losses, I mentioned unemployment, financial, losing your job, losing friends, family, college, high school, being a teacher, a employer, an employee, managing a phone call with your 2-year-old jumping around, not making enough money, your loss of a reduction in your support services and other changes in your lifestyle. All of these are large scale during this emergency event that happened to all of us and happened to all of those around us. And we need to realize that those losses happened at the same time. And so we are dealing with such complicated, and this has been a prolonged period of time. And we really have to adapt and be able to now move forward to heal and to recover. It's important to note through this pandemic, our children have been in such a challenging place to lose their educational experiences, to have lost their friends, even though our young folks, and we all complain about it depending on our age, with their reliance on their phones and their technology and their social media platforms, and whether they're good, bad, or indifferent. Our adolescents still experience such great loss, whether it was loss within their family, not having their family member home because they were helping others in the health professions, losing their teacher, their friend, that other additional support system, their sports, their activities. Our high school students who lost their graduations, their proms. I have a young lady going to prom this year, and the challenge to find a dress this year was insurmountable because of the lack of stock, having had no real proms last year and no purchasing and not knowing if they would happen this year. All of these emotions and experiences, they all fit into this experience of grief and loss and how each person is going to deal with us. Adolescents may experience significant changes in their sleep patterns and isolate themselves more. I can speak to the frequent irritability and frustration that comes with being withdrawn from their usual activities. And when we normally would reduce their time on technology, finding ourselves pushing them towards technology so that they could remain connected and invested. It's important for parents and caregivers to engage their adolescents over their grief to promote these healthy skills and some acceptance. And so when you think about speaking with your children, what kinds of questions, might be asked, should I be freaking out about COVID-19? We got to use their terminology. Why can't I hang out with my friends in person? They're feeling worried and bored or frustrated. COVID-19 is scary. And while anyone can catch the virus that causes COVID-19, and people of all ages and backgrounds can become severely ill, most people have a mild reaction, and are able to recover at home. So our young folks are saying, well, I'm young, I can handle it. But we as parents are saying, but you come home to me, or you come home to your grandparent. It's a lot of burden for our young folks. But regardless of your own personal risk, it is natural to be concerned for friends and family, and important for them to understand that. So things that we can do, I think very important for us to manage our stress is understanding COVID-19, be the educators, help stop the spread, washing our hands, social distancing. These actions help us from getting sick and help us from spreading the virus further. Wearing masks, people should not wear a mask, people should not wear a mask, our children who are under the age of 2. Anyone who has trouble breathing or is unconscious, incapacitated, or otherwise unable to remove the mask without assistance. We can be social, but we need to do it at a distance. We've had to reinvent our way of being in connection with those around us. We need to find ways to manage all that we are dealing with. Relaxation, taking breaths, stretch, meditate, activities that you enjoy, exercise, doing those gaming consoles with this technology, reading and other hobbies, try to keep to a schedule and plan, especially for our kids, to do their homework and connect with their friends, even if it's, in a vehicle at a distance. All of these things now are lifting with vaccination and with the virus decreasing, but we still have those folks that are scared to embark on all of this. So these kinds of interventions and suggestions are going to help them move forward. Avoid alcohol and drug use to manage the complications of COVID-19. We saw a major spark and increase in the, substance use and addiction. The opioid addiction is not decreased, but increased through the pandemic. We've seen a rise in domestic violence associated at the time with the stay-at-home orders, being at home with the person that you are unable to be comfortable with for your dynamics that are playing out and being stuck in the same place and not being able to leave and get the support you need. You need to talk with someone about your experiences that you trust and your thoughts and feelings that can help guide you. We can't emphasize enough, I heard Susan say it at the rollout of this presentation, get vaccinated if you choose to. If you choose not to, do not put yourself in danger. Make sure that you abide by the guidelines to stay distant and wear your mask to stay healthy. Grieving the loss of a loved one, we're coping with fear and anxiety related to COVID-19. I mentioned the issues of the stay-at-home orders and the loss of folks, the traditional funeral services and whatnot. These are all things that really became different during the height of the pandemic and are only now starting to change, but they may not change all of the way. And so there's a new normal that we're going to be looking at. Some actions to help with coping with those feelings or connecting with others and creating memories or rituals that are different now. And like I said, always ask for help from others. During the COVID-19 pandemic, the family and close friends of a person who died, there's a lot of stigma associated initially to having had COVID-19. My daughter, again, is a high school student. And even though a lot has lifted and improved, 16 was not able to be vaccinated yet, so safe and following all of the guidelines. She returned to school, she returned to sporting events, and unfortunately was exposed to COVID-19 during a practice for a sport and needed to stay home. And, things have changed now where you get tested at a different interval, not initially when you've been exposed. So she wasn't tested until she was in between that 5 to 7 days. But that few days leading up to that, her phone was off the charts of, do you have COVID-19? Do you have COVID-19? Were you in class with me? She felt a very certain way. That has not changed, that stigma, having gotten it. The aftermath of who came to practice with it? How did you get it? Unfortunately, for the young lady who made some bad decisions and had a social event not condoned by her parents, it became common knowledge that this happened and that she was the catalyst of the exposure at the school. Her parents got phone calls that were unpleasant. Because they were not home. So this stigma is something we all need to be conscious of and know that we are still dealing with this despite the numbers going down. We need to be conscious that those that we're treating and those that we are in our lives are struggling with, you did or didn't have COVID. Asking people if they're vaccinated has become a very big topic. Why are you asking me? That's my protected healthcare information. But people want to know so that they know that they can be safe. So it's important to know the facts and to be educators in our community. The stressors in mental health through this pandemic have been significant. Fear of the virus and the unknown that still exists today, despite knowing so much more. Fear of the vaccine, the pressure to or not to get vaccinated, the social isolation that I mentioned, the increased use of technology. This has made people very paranoid. Folks that already experienced these symptoms now heightened. Folks who have not experienced these symptoms, how many people have heard someone speak on Facebook or social media about not to get vaccinated because there's a chip in the vaccination and we're going to be tracked by the government. These are not my, traditional mental health consumers with paranoid thoughts. These are everyday folks concerned about, is the virus real? Was it really a governmental conspiracy? All of this is floating through our world. The increase in substance use to cope with these fears and with some of the expectations, distancing families and friends and our loss of supports, this grief and loss that we have spoken to. And the financial stressors, staying home too long without that care. So, I mentioned it in the beginning, the different grief reactions, the shock, the denial, anxiety, and, loss of appetite, lethargy. We need to be cognizant, to be aware that this can put some folks at risk for suicide. So it is important to keep that in mind for our folks, our colleagues and friends who have been exposed to so much through the pandemic, so much expected of them, so much expected of us. It is okay to not be okay. A previous talk that I did for you here at Valley, to be mindful of the risk factors that come into play, and to be assessing that folks are okay. Be that person that calls and checks on someone, especially after a loss of a job, a loss of a family member. Be assessing if someone has means to harmful interventions, and if they're isolating, and if they have any prior history. So I want to just talk briefly about, the impact of COVID-19 and the pandemic on our older adults, our geriatric and senior population, particularly those in our nursing homes, hit the hardest through this pandemic in terms of numbers, being isolated within their healthcare environments, and passing away in those environments without their family, their friends, those that they loved, being isolated, and their increased vulnerability of this population is so difficult. We run a 574 bed nursing home facility here at Bergen Newbridge Medical Center. To not have visitors because we're trying to stop the spread, and that isolation for our patients, to not be able to go outside because of the elements, to not let visitors in, to not pass with someone you loved, and to do that by technology. It's taken a tremendous toll, as we all know. Our older adults are far more vulnerable because of all of this to psychiatric decompensation during COVID, and that continues to this day. Many elderly people are not quite versed with social media. It's been a challenge for the vaccine delivery to get to those communities where we have folks who are not able to use public transportation, or don't have loved ones who are in isolated pockets, various people in our communities who are not represented well, who can't get to a mega site or a physician, to be able to get those vaccines out to them so that they can remove themselves from these isolated experiences, and be able to get back to normal. That lack of visitation has been so challenging. So many things have been done, creative things to be done by all of you and us here at Bergen Newbridge to change that, but nothing will change the touch of a hand and the experience of your family. So important for us to use those creative opportunities, call them more often, reach out and seek them out, be assessing, creating these visitation opportunities with technology, and vaccinating wherever we can. And it's okay to express how difficult the feelings are. It's always important for us to remember at the end of such a complex discussion presentation, how resilient we all are, and how resilient our children and our seniors and our patients and ourselves, our healthcare community is and has been. Psychologists define resilience as the process of adapting in the face of adversity, trauma, tragedy, threat, significant sources of stress, such as family problems and relationships, serious health problems, workplace, financial stresses. And I would certainly add to that the loss of life. We are an amazing, resilient entity as a person, and we need to focus on that. So it's important for us to make sure that we are providing opportunities for us to enhance and promote that resiliency. When we talk about how to help people, it's important to stress physical fitness, taking care of your body, getting out and getting back to your normal care regime, getting back to your physicians, getting back to your appointments. I myself, as many of you, have an elderly family member who I have been scheduling appointments for now post-vaccination for weeks to get eyes checked and a cataract surgery prior to the pandemic, getting physical therapy and hearing aids to allow that experience to be better and different, to make that family member more resilient. Sleep well, eat healthy, avoid mood altering drugs. interpersonal fitness, reconnecting with social supports, even if it's virtual, leaning on others and seeking out those supports, participating in all of this social networking. I can tell you I have a wonderful friend high school group through this pandemic that connected after many years. Some of us have been in connection in different ways, but we've had a regular Zoom like we're Zooming today. And we've had that through the pandemic every other week for 15, 16 months, and it has been a lifesaver and a support. But I can tell you that as everybody has jumped back to some level of normalcy, it has gotten more difficult to join. It's gotten more difficult to participate because we're driving children and are back to work events and functions and things of the nature, back to commuting into the city. And so, this week we made the decision to suspend the regular Zooming, but keep our group chat open so that we could jump on at any time. So you wouldn't feel the pressure of having to connect that way. So again, we're resilient, we're adapting, sharing our emotions with those we trust, and using pets. Pet therapy, tremendous pet therapy advantages. Adopt if you didn't through the pandemic, or if you have them currently, they've been a tremendous resource. Remember that we also need to fill our emotional fitness. We need to remember that we need to take care of who we are as a person and how we express ourselves and experience all that is put in front of it. Cultivating positive emotions through hobbies, creating a bucket list of emotional uplifting activities, but you got to do them. Make them small, make them achievable so that you can feel a sense of accomplishment. And please recommend this to those in your lives and those that you treat and that you're working with. Develop long-term goals, but also start the journey with short-term goals. Use positive humor and express your gratitude. Kindness is the best thing we can offer to anyone. We all have been frustrated and upset, but remember that cashier or college student who you had to wait in line with. Remember to thank them for showing up to work in the heart of a pandemic with a face shield and a mask on to support college. Not saving a life, but pushing our toilet paper through. Say thank you. In behavioral health, please develop a regular routine, a safe routine. Stay calm under pressure and try to keep your cool. Prepare for high-risk situations when you know they're coming at you because they're going to be difficult. Break it into doable subtasks. Take a news holiday, the best thing that we can all say. Something about over-educating ourselves with media. Unfortunately, I happen to live with someone who works for NBC News. I can't take a news break. My children actually are home to some extent virtually, and my husband is now home virtually, and they can't take a news break. But we have to then make a decision to be outside or be upstairs and separate ourselves because we want to stay healthy. Read to find comfort and really avoid making things worse. Rekindle hope and be positive. Very important to us. And the last thing I just want to put out here is complicated grief. This is when grief is ongoing in a heightened state of mourning. It really keeps us from our ability to heal. It doesn't happen to everyone, but it does happen. The signs and symptoms of complicated grief are intense sorrow, pain, and rumination over that loss, and focus on little else but that loved one's potential death. Some individuals experience feelings of grief that do not appear to ease with time. And in some cases, the symptoms, in fact, can get far worse. Our medical community refers to this as complicated grief. Many people with complicated grief feel extreme levels of guilt and wish that they had passed with their loved one. They experience deep sadness. We can often see this with folks, and I had this recently where someone passed and the other, the spouse, who was a dialysis patient, refused all treatment and unfortunately died quite painfully, although we helped through that, because they absolutely did not want to be without their loved one. This was someone not treated here at the hospital, but in my life. Treating complicated grief is very similar to learning to manage normal grief, but it may require additional supports and treatment that is, not your standard, getting and reaching out to that counseling and getting that therapeutic care, perhaps medication interventions from a professional will make the difference. Grief can increase inflammation and can worsen our health problems, especially when we don't pay attention to what's happening to us through that process. It can batter the immune system and leave you relatively depleted and vulnerable to infection. The heartbreak of grief can increase blood pressure and the risk of blood clots. Your brain is on overload, and thoughts of grief and sadness and loneliness, those feelings really take over, can be referred to as grief brain, and it affects your memory, concentration, and cognition. Your brain is focused on the feelings and the symptoms of grief, which then leaves such little room for all the rest of the tasks we need to do in moving forward. So I hope that, I've been able to give a good picture to all of you about the management, the experience of grief. I also hope that I've been able to move it beyond the loss of a loved one, and put it into context of what we're dealing with in COVID-19. And again, while we are on the upswing of the virus currently, with the variants out there and things happening throughout the world, we need to stay hyper vigilant and aware of what is in front of us, because it could come back at us, maybe in a different way. And this understanding, this knowledge, and these techniques will be a life saver to someone that you encounter in your life. So I thank you very much for your time. And if there are anyone who has questions, I'd be happy to answer anything I can.
Oh, Kristine, thank you so much. That was just wonderful, so comprehensive. It touched on so much. I was talking with someone recently who was, just reading an article and talking with someone at the hospital, and they were saying, now that I'm not in the midst of the chaos, a lot of the feelings are starting to surface, right?
Absolutely.
A lot of times that happens a year after a loss, right?
Absolutely.
So I think some people are dealing with that. And I love the way you talked about just all the different symptoms and different way grief presents. And I think one of the most important thing is to recognize that grief can present in many different ways. And just to recognize, awareness is huge, really huge. And I think acceptance of those feelings and just sitting with them, which is so uncomfortable, is really key, at least for me and a lot of people I work with,
Oh, absolutely. I think for our healthcare community in particular, to go back to normal business is a challenge. It's such a challenge for us, and to be at that heightened state, to be is so in tune with the pandemic, and now to be dealing with it in such a different way. We're reinventing our work life. In some ways, it will never go back to, it's hard for me to say, it'll never go back to normal, because we've surpassed that now. And so the new normal, that catchy term now that we all hear, it really is a reality. So reinventing and understanding what our world is today. And for many people who think, the numbers have changed. I mean, I know that I'm sure you are still dealing with COVID. I am still dealing with COVID, with staff who are experiencing it, or patients who come in with it. We're dealing with testing, we're dealing with vaccination. We've all reinvented ourselves in this field so many times, in this profession so many times, that what we used to do is like a foreign concept. But that in and of itself is a loss.
Absolutely. Absolutely. It's so well said. And I work with a lot of older people throughout my career. And one gentleman said it best, said, what, if you're not flexible and open to new, ways of dealing with things, it's really, really hard for you.
Absolutely.
Now, guys. Woo.
Absolutely.
Being
Absolutely.
open. Thank you again. Appreciate so much everyone tuning in for this very important program. So thank you, Kristine. So at this